Hello, so today I'm going to show you when someone has a diastasis, where exactly you should be looking. So we know diastasis occurring from pregnancy. In that pregnant person, you're going to get that elongation, like that rib flare happening here. Their recti will elongate and recti will split. So when someone has a separation primarily up here, over the belly button or under the ribs, we definitely want to make sure that they don't have a rib flare. So when they have a rib flare, you can see by extension their back will need to be assessed. So when you assess your client's diastasis, you want to make sure you're palpating right from under the xiphoid process all the way down to the pubic bone. So when they have a rib flare and with their belly going up, you can see that the back is going to get strained here, the mid-thorax. Go ahead, don't flare your ribs. That is the thorax without the rib flare. Go ahead, please flare your ribs and see how much tension that puts in that mid back. So when someone has that separation in their linea alba up high, you definitely want to check the thorax from like T5 down to T12. It will be very strained, it may be painful. Your client may not even necessarily say, I have pain, but you're like, I'm just gonna check it out. Let's let you flip you onto your belly and palpate, and for sure you're going to find restrictions. So with the separation of the diastasis being in the midline, it's going to require fascial work, mostly coming together from each side for the transverse abdominis. So this will require palpating along the lateral border of the rectus, normalizing that, and also assessing the side line, and our treatment will be more about normalizing that relationship. If someone has a separation lower, right above the pubic bone and under the belly button, then they are going to have tensioning around their hips. This is a slightly more rare presentation. I would say the belly button happens the most often, and in that case, very rarely does someone have bilateral stretch. They most likely have a unilateral fascial tension happening into one hip. So this is how you will assess the fascial integrity of not just the abdominal wall, but of their whole frame. Looking at the back of the rib cage, looking at the hips based on where the diastasis was. Now, if you want to learn actual techniques on how to treat these restrictions, how to assess and how to restore alignment, then you definitely want to take our courses, starting with Integrative Pelvic Care for Pregnancy that's coming up in a month in November. So you will take that, and then you have the opportunity to take the Integrative Pelvic Care for Pregnancy in postpartum as well. Come back, we'll have lots more tips for you to treat your clients more efficiently, delivering better, quicker results with less strain on your hands and your own body. It was a pleasure like always, and I will see you soon.